Hi everybody, welcome to my session today where I'm going to provide a simple overview of the Plan, Do, Study, Act, the PDSA model for improvement, and I'm going to link it to a practical example of a project that I've been linked with. If you find this video helpful, remember to give me a thumbs up. And you may want to check out some of my other free videos on my YouTube channel. So they're helpful for healthcare professional students, looking at quality improvement in modules or a dissertation, or if you have an interview coming up, looking at an overview of the key terms linked to quality improvement and quality assurance in healthcare. So I hope you find this video helpful. So if we firstly look at the concepts of quality improvement, very simply, quality improvement aims to standardise processes and structures. So variations are reduced in processes, systems and practice, and that leads to patient outcomes being improved in some way. An example might be a quality improvement project that aims to introduce a screening tool to improve early identification of patients with sepsis. So within this example, variations are reduced as staff use this standardised screening tool, and patient outcomes should improve, and as more patients are identified early on with sepsis. So the knock-on effect is a decrease in mortality rates for sepsis. When we look at quality improvement methods and the quality improvement tools, they have different uses and purposes and aims. So some tools will aim to measure care against agreed standards to improve quality, such as audit. Understanding the cause of the problem may be the focus of a tool, which would be an example might be root cause analysis, using a fishbone cause and effect diagram, and you identify possible causes linked to a care issue or service delivery. There are tools that plan and test an improvement, such as the Plan, Do, Study, Act model that I'm going to talk about today. We also have the Lean model that focuses on driving out waste and improving flow to improve patient care. Six Sigma focuses on reducing variations in processes and using statistics and data analysis to reduce errors. And then we have the Lean Six Sigma that combines both those approaches. We have other tools looking at promoting change in practice, such as decision support tool or decision trees that use this tree model of decisions, and that looking at the possible consequences of decisions. You look at outcomes, resources and costs, for example. A very good practical guide is from the Healthcare Quality Improvement Partnership in 2020, a guide to quality improvement tools. So if you are looking at quality improvement in your modules as students or as post-registration healthcare professionals, that's a great start and a good resource. So if we focus on the Plan, Do, Study, Act model, it's simple and it's the most popular tool for quality improvement in healthcare. It's based on this trial and learn approach, where you make a small change, you measure if it works, and then you reflect on it, you learn from it, you might adapt it, you might go through another cycle, you might keep it in place because it works well, but you have to continually evaluate whether it's worked. Cyclical model is based on the principles of continuous process improvement that include these four key stages of Plan, Do, Study, Act. And the PDSA cycle evolved from William Edward Deming's wheel in the 1950s, and he originally created this Plan, Do, Checked, Act cycle, and he was this trailblazer of the quality management movement at the time. As we mentioned earlier about quality improvement, the PDSA cycle aims to improve quality and reduce cost. And it's most effective when a procedure, process or system needs changing in a local service, so a small scale change. And you can introduce quality improvement and refine it locally prior to widespread implementation. So you've got this trial, seeing whether it works, and testing. So prior to starting a quality improvement project and implementing a PDSA cycle, you need to think about some key areas, and the Institute of Healthcare Improvement Model of Improvement identifies these three key questions that are very helpful, and they need to be answered for successful quality improvement by a team. And I would say that is key to the success of any quality improvement. It's about networking and collaborating positively across teams. So the questions: what are we trying to accomplish? What are you actually trying to achieve? How are you going to know that a change is an improvement? So how are you going to measure improvement? What is the specific aim? It needs to be measurable and time specific. What change can we make that will result in improvement? So what measures are you going to use to determine whether the change led to an improvement or not? And these are really important questions to answer. And often these questions are very helpful to start focusing down your ideas, because at the beginning you've got an idea, an area, but it needs to be focused down into a measurable improvement that you can show impact, and either it works or it doesn't. So there needs to be some measurement and some data collection as part of that quality improvement. It's helpful to look at an actual example of a service improvement project linked to a PDSA cycle, and I've chosen a project that I was involved with. Ariel, Anada and I wrote a paper on this service improvement project, so there's a lot more detail in our article, and it aimed to reduce variations in clinical nurse educator roles. It's a service improvement project to standardise roles and career pathways. So the issue was a lack of standardisation of clinical nurse educator roles. There was different job titles, job plans in the hospital division linked to different bands. And there was a need for clear career progression pathway for clinical nurse educators to improve retention. So the aim of this project was to reduce variations in clinical nurse educator roles, job titles and job plans by implementing new standardised titles, job plans for bands 5 to 7 that aligned to a career progression pathway. So the aim was to improve clinical nurse educator and manager satisfaction and to improve retention. So it's quite a complex project, not one that you would probably choose for a quality improvement or quality service improvement project. For a dissertation, you'd focus more narrowly on one aspect, but it's interesting to look at it relating to the PDSA cycle, because there's lots of elements to it. So I hope you find that helpful. The second stage to a PDSA cycle is the planning stage, and in many ways this was the one that was most time consuming in our project, in that you have to be really clear on your data, how you're going to measure the change, progress, or whether it's worked or not, and think about those data collection tools of how to collect data to show that. And it's helpful to reflect on the current situation first of all. So what is the problem or the area that needs improving? What are you trying to accomplish? What change would improve the situation and make it better? And using a team approach to that planning is essential. You should end up with a clearly stated measurable aim. It needs to be time specific and it needs to align with the institution and the profession. So thinking about what's going to happen when you implement the change before you do implement it. How are you going to measure improvement? What impact will this change have? And that's where you might think about your data collection tools there as well. And then networking, that can take time to gain authorization, working across a team, and your implementation plan should be underpinned by an evidence base. Linking the planning stage to the service improvement project I was linked to, the issue was variations in clinical nurse educator job titles and job plans, and managers were interpreting those roles in different ways relating to clinical duties, administrative and teaching duties for those clinical nurse educators. And there was also this lack of a clear career pathway for clinical nurse educators. So there was a scoping, the evaluation as part of the planning to review perceptions of managers and clinical nurse educators of that role, and that was done through questionnaires and focus groups as part of the planning, and that showed the frustration of clinical nurse educators and the differences across areas, and there was this need for more standardisation. So the change that was implemented was standardised job titles and job plans for clinical nurse educators in a hospital division, along with clearly defined career pathway for clinical nurse educators. To measure the change as part of the planning, we were going to get clinical nurse educators and managers to feedback post-implementation using questionnaires or interviews, focus groups. We could use different methods, and then looking at retention and career progression data specifically for clinical nurse educators. When implementing any quality improvement, it's essential to gain authorization from the appropriate people. So with our project, it was the divisional lead, matrons, we would not have been able to have implemented a change looking at different job titles and the job plans without buy-in from our matrons, and collaborating with clinical nurse educators. And we found it very helpful to have a divisional steering group. We had an education lead leading the project, Ariel Lanada, and gaining agreement on the job titles, the plans and the career pathway before we implemented the change was essential. And this is quite a larger project that you would do for a dissertation, for example, but the principles would be the same. Team support is essential, and finding out where you gain authorization. Another key thing is to start small, and also to pilot any data collection tools, any questionnaires. If you're going to lead a focus group, what questions are you asking? And then testing the change on a small scale, monitoring progress is very important. The third stage of the PDSA cycle is the study stage, so reflecting on the test, the change that was implemented, and analysing data. Has the change worked as you predicted? Does it differ or align from what you predicted or what you expected to happen? Who have the changes affected and how? Have the effects been positive or negative? Or what part of the change didn't work and why? Are the changes worth keeping or do they need adapting? So you're summarising what you learned to inform future work or disseminate success. So linking the study part of PDSA to the service improvement project that I was linked to, so reflecting and testing and analysing data, we found that it worked having a Band 5 Associate Clinical Practice Educator, Band 6 Clinical Nurse Educator and Band 7 Practice Development Nurse with clear job plans and a job profile. Post implementation, there was an increased number of clinical nurse educator roles from 12 to 17. So it was helpful to recruit clinical nurse educators. 90% of senior nurses and 100% of educators fed back positively post implementation. So one matron, for example, fed back that the job profiles and career pathways helped attract 5 applicants to a previous vacant post. So the number of positions was increasing. 5 educators started postgraduate teaching courses, 2 completed masters and 2 started a doctorate. But you can see that looking at our measurement for the impact on our quality improvement, service improvement project is quite different to, say, a patient clinical outcome project that might be looking at patient complaints or quantitative data linked to admissions or discharges. It's very much dependent on your project. Ours related more to sort of these clinical roles and staff experiences, essentially. So a summary of what we learned: it unified our nursing team, but it was hard to know what to evaluate when linked to staff development initially, and it was only through scoping reviews that it was clearer to understand what we could use to show that impact. So the final stage of the PDSA cycle, where you act on your reflection, look at what changes should be made for the next cycle. So you need to decide whether to spread, to stop, or to implement the change further. Are there areas that need modifying or adapting? Are there any negative effects that need removing? Implementing change on a small scale is important until certain of improvement, and then widen out. So with us, we embedded it across our change across the division because it worked. But you repeat, you tweak, you change until the desired change matches the aim. And then also it's helpful to publish your work, and I would encourage anybody that's doing quality improvement projects to publish your work, to share and disseminate. And if you're not interested in writing and feel that it's too much, to collaborate with other authors potentially is helpful to get your work out there. If you're interested in doing a quality improvement project or service improvement project, there's some fantastic resources on the NHS and the National Institute for Health and Care research websites for quality improvement frameworks, models, tools. Many employers have quality improvement QI hubs and local QI leads and networks, and they're fantastically experienced staff who are able to talk through your project or offer some advice on data collection tools, for example. There's the Healthcare Quality Improvement Partnership website, the Health Foundation, some other professional bodies, national forums, and then the Institute for Healthcare Improvement. And I also have some key references. I've got some videos on my YouTube channel as well you might want to check out, and some helpful resources references, that have got some papers that have good papers, simple overviews to read. So that might be helpful. So if you have any questions at all, do pop them in the YouTube channel. Give me a thumbs up if you found this talk helpful. You might want to ask me questions more privately on Twitter or on my website. And if you're interested in any of my books, the links to my books are in the YouTube description. And good luck with any projects that you might be doing in the future.